Well, let me begin with a very interesting story that happened exactly a year back. A very reputed school in Hyderabad had invited me as a chief guest for one of their annual day events. Well, following the COVID protocol, the students sitting in the auditorium were all wearing their masks. They never removed their mask throughout the whole program. Even during the photography session, they just removed the mask for a few seconds and again put it back. And watching all of this, I went to them and I asked them, why are all of you wearing the mask? And all of them shouted and said, it's COVID-19. And then I asked them, what else do they know about COVID-19? And trust me, they knew so much information, almost as good as a health expert. Well, as a mental health expert, I was inquisitive, so I wanted to ask them if they knew something about mental health. On asking this, there was pin drop silence. After a little while, I could hear one or two voices saying words like anxiety and depression. And when I asked them what is anxiety and depression, again there was pin drop silence. I started to think why these beautiful brains, which could speak so much about COVID-19, couldn't speak anything about mental health. Well, the answer is very clear, because they were never taught about mental health. Neither the families, nor the schools, nor the society. Nobody spoke to them about what mental health is. And this is what scares me, because to protect ourselves from the pandemic COVID-19, we all had masks. But unfortunately, mental health issues do not have a mask. Well, is mental health really the next pandemic? If you look into the screen right now, there are two articles. The first on the left is an article from a reputed journal called Lancet, and the second one is from the British Medical Journal. And both of them talk about how post-COVID-19, there has been a sudden surge in mental health issues, somewhere hinting that there could be a new pandemic, which is a mental health pandemic. Well, when you're talking about mental health, let's try to talk about the burden. Globally, 1 out of 8 individuals are suffering with mental health issues, according to the World Health Organization. Well, the prevalence of mental health issues is 50% of mental health issues start by the age of 14. If you look into the data in regards to a country like India, 20% of population by 2023 is actually going to be having mental health issues. And this is what the World Health Organization states. WHO even says that the economic loss because of the mental health issues is going to be as much as $1.03 trillion between the years 2012 and 2030. In a country like India, 1 out of every 7 individuals is having a mental health condition. And when you look at the mental health workforce, we only have 0.75 psychiatrists for every 1 lakh population, which is far less than the minimum number, which is 3. And to get to these numbers, India is at least going to take another 42 years. Well, while these numbers are very alarming, something more alarming or equally alarming for me is the current understanding of mental health. Let me tell you a small story, a story of an adolescent child who had symptoms of depression and anxiety. The child went to the parent and said, I'm feeling these symptoms, and the parent, after a lot of hesitation, finally decided to bring them to the psychiatrist. And now this is the conversation happening between the doctor, the child, and the parent. The child says, I'm unable to get out of bed. And the parent says, this is your laziness. The child says, I'm not able to meet my parental expectations. And the parent says, you're very stubborn. The child says, I'm not motivated to study. And the parent says, I think you need to change your friends. The child says, I have severe pain in my stomach just before an exam. And the parents say, no, you're acting, stop acting. The child says, I feel like crying. And the parents say, you're regularly sad. And the child says, I'm feeling very tired. And the parents say, you need to use your willpower. And the child says, I'm not able to concentrate. And the parents say, it's all in your head. And now, after all the brainwashing that the parents have done, this child, this adolescent child, when grows into an adult, starts having these misconceptions that their mental health is a sign of weakness. And this gradually starts increasing those negative symptoms of worthlessness, hopelessness, helplessness, and all of this finally pushes this individual into a very serious mental health disorder. Well, this is the time we need to step in and revolutionize our concepts of mental health. So let's try to understand what the brain is all about. The human brain is made up of neurons, which is the most structural and fundamental cell of the brain. The human brain has around 100 billion neurons, and each of these neurons are connected to each other. Every neuron almost has around 10,000 connections. So, well, if you put all these connections together, these are more numbers than the stars in your Milky Way. Now, what do these neurons do? These neurons communicate with each other, they talk to each other, and this talking is called as neurotransmission. Well, neurotransmission is one of the most important activities which regulates all the functions that come from the human brain. Starting from basic functions like sleep, appetite, regulating your emotions, regulating your impulses, cognitive functions like attention, focus, concentration, memory, and higher mental functions like judgment, decision-making, problem-solving, intelligence. All of this is happening because of the neurotransmission. Well, now we clearly understand that these neurons are the most important part, and the health of these neurons are directly predicting your mental health. But now what happens in a mental health disorder? Somewhere this communication happening between these neurons is delayed or distorted. And when this happens, that is when an individual develops a psychological condition. Now, what really regulates these communications and what is stopping them from communicating? Well, I would divide them into two factors: internal factors, external factors. Internal factors are our genetics. External factors could be the nutrition the child is getting, or the kind of infections the child develops. It can be physical abuse, it can be psychological abuse or emotional abuse. All of them actually regulate how these neurons are actually healthy or unhealthy, or if the neurons are communicating well or not communicating well. Well, now, does that mean that there is nothing in an individual's hand? Is everything beyond the voluntary control of the individual? Not really, because there are some activities which are in the voluntary control of every human being which can actually protect or make these neurons healthier. Now, what are these activities? Well, sleep, the diet, the sunlight, the exercises, and in the red, something that deteriorates your neurons' health are substances or psychoactive substances. Well, when we talk about sleep, I would say that sleep is one of the most underrated medicines. A good 6 to 8 hours sleep can actually regenerate and repair a lot of the neurons in the brain and make them active for the war the next day. A lot of times we don't understand that sleeping 8 hours is not just enough. We need to sleep the right 8 hours when the melatonin levels are high in the brain. As a psychiatrist, I would say that sleep disturbance could be one of the most important factors that can predict a relapse or a new illness in an individual's health. Right in front of you is a picture of two brains. The same individual was taken, for some cognitive tests, some calculative tests. One, when he had a good night's sleep, that is the left side of the brain, the left side of the picture, and two, when he was sleep deprived. And very clearly you can see in this image that the left hand picture, which says that the person had a good night's sleep, clearly has a lot of activity happening. All the yellowish coloration that you see is the activity that is happening when the person was doing a task. And when he was sleep deprived, you clearly see that the activity has come down. Now, looking into the next picture, which speaks about diet. Well, we all know that eating healthy is important. Eating bad is not just harmful for the waistline, but it is more harmful for the brain. Well, the picture in front of you speaks about a study which was done in two different individuals, one who has a Mediterranean diet and two who has a Western diet. And the results are very scary, because the person who was having Western diet had structural changes happening inside the brain. These changes are very close to the shrinkage of the brain structures, which is also called as atrophy. And this atrophic change can actually lead people into mental health issues or even conditions like dementia. Well, we all know that sunlight has vitamin D3, and we all know that vitamin D3 is very good for the bones. What we need to understand is vitamin D3 is not just good for the bones, but very important for the brain. Vitamin D3 helps in producing a lot of important chemicals that the brain needs. And at the same time, vitamin D3 is also necessary for producing melatonin, that is your sleep chemical. Talking about exercise, yes, the picture says it all. Your brain loves exercise. Every time you exercise, the chemicals that are produced in your brain, like serotonin, dopamine, endorphins, oxytocin, all these are happy chemicals, pleasure chemicals. So that's the reason they say exercise is the best antidepressant. Now talking about the last thing that we spoke about, substances. And now when I'm talking about addictive behavior, it's not just the substances like caffeine, alcohol, nicotine, cannabis, or drugs, but even the electronic media addiction. And the brain scans clearly speak about how there is an increased activity in a healthy brain compared to somebody who's having an addiction. Well, right here we understand that there are a lot of things that are in the voluntary control of an individual to actually protect your neurons. Well, is all of this enough to bring about a change? Maybe at an individual level, but what should we be doing to bring about a bigger change at a societal level? This is where I come to talk about my solution, which is the 5 A's. The first A is acknowledgement. When I'm talking about acknowledgement, I'm talking about recognition. This article here, taken from the Indian Journal of Psychiatry, speaks about how the author in his research understood that out of the whole population that he studied, 55% of people, when they had psychiatric symptoms, first went to non-psychiatrists and even faith healers. This clearly explains that people do not recognize mental health issues. The problem here is, by the time this individual who's gone to a faith healer realizes that he has a psychiatric issue, a lot of time is gone. That means a lot of neurons are gone. So the first thing is acknowledge. Second thing is awareness and acceptance. Something that is well begun is only a half job done, if you ask me. That's the state of mental health awareness at this point. Let's try to take a small quiz. Let me ask you, how many of you know what is the first treatment that you give for someone who's having fever? Quickly, hands up. When you have fever, what is the first thing that you give people? Yes, it's paracetamol. Now let me ask you, what is the first thing that you are going to do when you see someone having an anxiety attack? This is the problem. Accepting and being aware that psychological conditions exist is not just enough, but we need to actually build our knowledge about these conditions. The next A I would like to talk about is assist and talk. We all know that at this point, the greatest hurdle that mental health issues have is the stigma. Stigma can be of two types. It can be a direct stigma where I directly hurt somebody by negatively commenting on their mental health. Or two, it could be an indirect stigma where I'm trying to avoid somebody because I feel maybe they're going to have an emotional breakdown or they're going to get violent on me. Come what may be the stigma is, this actually impacts an individual's health. The person who is stigmatized starts feeling that his mental health issue is a very huge problem. And a lot of times, people do not even take treatments from psychiatrists with a fear that I'm going to be labeled. So the first thing that we need to understand is we need to listen to people out in a non-judgmental manner by creating that kind of comfort and giving them that confidentiality that yes, we are there for you and we are not judging you. And that is the most important aspect about stigma. Let's not forget how 2 decades back, it was very difficult for individuals to talk about menstruation. But today, the more you talk, the stigma has started coming down and people are now very comfortable to talk about it. Let's hope that mental health also soon attains that status. The last thing I would like to talk about, the 5th A, is the action plan. Increase awareness and education. Mental health has to be inculcated into children's lives very early. Mental health has to be made a compulsory subject so that people understand that these are the symptoms and these are the techniques. The second thing, focus on prevention. Like I said, not just talking about mental health, but talking about some techniques that can help or protect the brain can actually help us on prevention. We all know prevention is better than cure, and the first step for prevention is actually motivating ourselves to do something that can help the brain. Third, incorporate mental health in primary health care. This is very important because a lot of individuals who could be coming to hospitals with different other illnesses, it could be cancer, it could be diabetes, it could be heart issues, could be having a comorbid psychological condition. So if you want to actually recognize them at a very nascent stage, and if you want to start intervening at a very initial stage, you need to incorporate it in physical health care, primary health care. And the last one is collaborate with community organizations. We all know the role of community, especially during the pandemic. Community can reduce the stigma. Community organizations can actually bring around experts to talk to the local audiences. At the same time, community organizations can even help in rehabilitation. The last thing I would like to say is pillows do not wipe tears. Pillows only absorb the tears. So we need to stand up as mental health advocates and mental health warriors to replace the pillow for an individual and help them understand that we are not just absorbing, but we are here to listen to you, help you, and get you treated. And this is my topic for today, talking about how important it is to revolutionize mental health from becoming into a pandemic. Thank you.